Ready? Okay. So before I enter the room, I already prepped the medications, ready to draw the ondansetron and check them to the MAR twice. Check for any precautions, allergies before I enter the room. Here I am. All right, so knock knock. Hello, I am Pablo. I'll be a nurse today. Can you verify your name and date of birth? And let me check your name tag. Okay, perfect. I'm here to I brought you some medications here. I have your normal saline to hydrate you. I have antibiotics. I have the ondansetron for any nausea, vomiting, and I also have your flu shot for your request. I'm going to provide privacy to the patient, form and hygiene, and some gloves on. I'm going to take a look at the MAR just to make sure I have the right medications and go over the 5 rights. Just the right patient, have the right medication, the right route, right time, and the right dose. Okay, so while keeping this sterile, gonna open it up. Sure there are no kinks to it. I have the cover here. I have my normal saline. I'm gonna hang this right here. This is still sterile. I'm gonna spike it, make sure I have it clamped so it doesn't leak anywhere. Oh. Okay, then I'm gonna prime this by unclamping it and watching it closely for any bubbles. Before I do that, I'm gonna fill the chamber. Should be good. And then I can prime it. This is open, and so is this. You can see the bubbles coming out. Perfect. So then I'm gonna hang on to this, don't let it touch anything. Gonna go and check the antibiotic against the MAR to make sure I have the right patient, the right medication, the right dose, the right route, and the right time. Perfect. What I'm gonna do is I'm gonna open this with freaking gun extension. Actually, I can just hang this in here. That's good. And then I will open my secondary. And grab an extension here. I'm gonna hang the primary lower to use the force of gravity to get the secondary to go first. Should be okay. And get my secondary line. This is still sterile. It's brand new. Didn't touch anything. I'm holding this. Make sure it's clamped. And it is. Open this. And this one is important to not let anything go to waste because it's a medication. So I spike it. Fill the chamber. Perfect. Then I can go and wipe the port. For 30 seconds, 28, 29, 30. Open. Connect it nice and tight. Actually, I'm gonna prime it first, and I can wipe that later. So I'm gonna open here and prevent from having any bubbles on the line, and open slowly to make sure nothing goes to waste. I see the bubbles coming up right here, and that is good right there. Use another wipe just in case. That is connected. All right. I'm gonna keep this aside. It's gonna hang in here so it doesn't touch anything. And it's still sterile. I'm gonna do now, I'm gonna push the ondansetron, which I prepared before. Check it against the MAR. Make sure it's the right patient, right medication, right dose, right route, and right time. I'm gonna get a wipe. And before I enter the room, before I did anything, I would have lift up the bed and make sure it's in a comfortable position. To me right now is good. I'm not crouching down or anything. And I would connect to the port after wiping it, unclamp it. I'm already checking the IV side. There's no infections, no signs of infections, no infiltration. Doesn't look anything red or anything like that. And now okay, do I want to flush this first before the medication? Yes, I do. So I'll take this back. Get a new wipe. Wipe the port. Got a flush and use about 2 to 3 milliliters to flush it. It's all unclamped. Just go slow, and I'm watching the IV side. Everything looks good. And then I can push the ondansetron, which is 2 milliliters. And I want to do this over the course of 2 minutes. So 1 ml per minute. 1 ml for so called 30 seconds, and then I'll inject the other ml. And then I'll wait and give it the rest. toss this. And then what I want to do is flush it one more time. Make sure there's nothing on the line. This was sterile all the time. I mean, I didn't touch it with anything, but just in case, I'll wipe it again. Doesn't hurt. And back to flush. It's just normal saline. Another 2 or 3 mLs. Flush it. I'll keep this connected. Yeah, this side looks good. Now I would go ahead and connect this, controlling the rate. This will be 8 drops every 15 seconds. The normal saline, which I have to come back and check after this one is done, would be about 5 every 15 seconds. So I'm gonna check my time here and make sure I got the right drip rate. Should be good. All the clamps are closed. This is set. I would disconnect this. Connect the line. And since I already closed the clamp here, I would just like fix the rate again and check my time there. It'll be 8 strips every 15 seconds. That should be good. Okay, so the IV is there. He's doing good. I think that part is done. Then I'll go ahead and prep my my flu shot per the patient request. I will do a little hand hygiene again. New gloves. Attach my syringe to the needle I'm gonna draw the medication with. Check the medication against the MAR. Check it's right patient, right medication, right dose, right route, and right time. Attach it so I can draw the medication with. Remove the cap. Inject some air into the vial. And draw 0.5 mL. Three, 0.5. Oops. So I'm gonna just prime this. That's a 0.5 there. I would then get rid of my needle I used to get a medication with. And actually, the needle I'm gonna inject it with. So here we go. So I'm gonna perform this in here. It would have been on his deltoid. You find the acromion, the bone right here, and go 2 fingers down. It should be around this area right here. I'm gonna use the Z method. I'm gonna spread it. I'm gonna use my wipe. It'll be a 90-degree shot. I'm still spreading the skin. There we go. Pull it out, and then let's can go back to. I would then recap it. This will go on the sharps container. I would have put a gauze here and pressure. Just for the sake of the video, I'm gonna go ahead and not do this right now. I'll remove my gloves. Do hand hygiene. Ask the patient if he has any questions. How's he doing? Check the IV site one more time just to make sure nothing is wrong. He's doing okay. After this, I would go and put the call light right next to the patient, put the bed down to its lowest position. I would go out of the room and document everything, including how the patient reacted to the medications, if there was any concerns, and how it all went. And I would retract the curtains, turn off the light, and I'm done.